Did you know that hemorrhoids or piles affect both men and women? Well, it does, and the symptoms are pretty much alike. Today, KAREEM'S clinic explains to you what hemorrhoids are, what causes them, the symptoms, prevention, and treatment of the same. As we delve deep into this, it is worth noting that hemorrhoids, or what we call piles, are lumps inside or around the anus due to swelling of the veins around the anus. Now, what makes these veins to swell? When the walls of the veins or the blood vessels around the anus and even the rectum stretch, when those walls stretch, they get irritated, and when they get irritated, they swell. When they stretch, there's a lot of blood that flows in them. When this blood flows in them, the swelling now takes place. Probably a clot would happen, or just the volume of blood increasing in quantity means that the swelling would take place in order to counter the pressure. Both men and women experience hemorrhoids. In fact, the number is very high. At least in every 4 adults, 3 have experienced the piles. Now, what causes these piles? Pregnancy is the first cause of piles or hemorrhoids. When a woman is pregnant, the weight of the baby applies a lot of pressure in the rectum and even the anus. That means that the vessels around the anus and the rectum would stretch, get irritated, and swell. The next cause is chronic constipation. We have normal constipation and chronic constipation. Chronic constipation is that constipation that goes for a lot of days or a longer period than normal. So if you are constipating, then the constipation itself could lead to formation of hemorrhoids or piles. If you are also overweight, chances are very high that piles will catch you. Heavy lifting also applies pressure in the rectum. Somebody's already thinking, so what about my deadlift at the gym? What will I have to do with it? Kindly, it is not wrong to do deadlifts at the gym. It is not wrong to do heavy lifting at the gym. However, if you realize that you have had piles before, or if you realize that heavy lifting, after doing your heavy lifts, you experience the piles, then do light lifts. People who are doing heavy jobs, carrying, especially the jobs that you walk carrying luggage, if you realize or you notice swellings around the anus, then always think about these jobs as a cause of the hemorrhoids. Then we have chronic cough. When you are coughing and the cough is chronic and it takes a longer period to stop, you will agree with me that as you cough, there is too much pressure applied in the rectum, and that can easily cause hemorrhoids. People who eat diet that is low in fiber, you eat a lot of fats, and your diet is low in fiber, also get hemorrhoids. Sitting for too long at the office or just sitting too much will also lead to hemorrhoids. Aging. As you grow older, the anal canal becomes weaker, and when it becomes weaker, that lining can easily expose or overstretch the veins or the blood vessels along that path. That would lead to hemorrhoids. And finally, we have genetics. Hemorrhoids sometimes are hereditary. When you come from a family that complains about hemorrhoids, then chances are you would complain about it as well. Now, these are the possible causes of hemorrhoids. But not all these things that I've mentioned would lead to hemorrhoids, because somebody would be asking themselves, but I've been lifting heavy at the gym and I didn't have it. I've been pregnant 3 times, I've not had it. I've always experienced constipation, I've not had it. What I'm saying is, avoid potential problems before they arise. What are the symptoms of hemorrhoids? The symptoms of hemorrhoids, hemorrhoids, we have the internal and external. Hemorrhoids can come towards the anus. It can grow towards the anus. The swelling can get extrapolated from the anus outwards. There are those that even hang, but again, they are internal swellings, hemorrhoids that occur deeper within the rectum. Those ones, you will not see the swelling because probably the swellings will not come out. They will remain deeper in. So either way, whether the swellings can be felt or not, hemorrhoids have got symptoms. And you don't actually wait for the swellings to appear so that you say you have hemorrhoids. So the first symptom is the swelling, as we have said, lumps around the anus. The second one is bleeding, especially when you see blood in your stool, then it means you have some bleeding within. So that bleeding could be caused by the hemorrhoids. So sometimes you touch the area and you don't feel the lumps, but blood comes out. It could mean you have a deeper degree within. The hemorrhoid is deeper within the rectum. So we have pain and discomfort. So when you feel a lot of pain and it is accompanied by bleeding, always seek medical attention, because it could be hemorrhoids. But again, bleeding deeper there could simply mean that you could be having some rectum issues, probably colorectal, bowel cancers. But don't always judge and reach a point where you think you have cancer before visiting a health facility to rule out the case of hemorrhoids. You could also have slimy mucus discharge, feeling like your bowels are full. There are people who feel like, my bowels are full. I've tried to relieve myself in the toilet, but I don't feel relieved. So you feel like you want the urge to defecate or to poop again and again. That could mean that you have hemorrhoids, even other issues with your rectum, as I mentioned before. So how do you prevent? How do you make sure that you don't get hemorrhoids? As I've said, up there, constipation, you must drink a lot of water and also eat food that is rich in fiber, so that you don't become overweight and you also don't constipate. Always exercise to avoid the overweight. Make sure your stool is soft, and by making sure your stool is soft, once again, I insist and emphasize on high fiber diet. So how will I treat? Somebody somewhere, you have hemorrhoids, you're sure it is. How would you treat this? Number one, always use mild laxative like lactulose to soften the stool. If you go over the counter to a pharmacy shop and you explain to them what you have, remember I'm explaining all this so that you have an idea of what you could be suffering from. So when you go there, explain exactly what you are suffering from so that they also compare with what you are saying. You can always suggest to them that you are suffering from hemorrhoids. So the practitioner would always demystify that after checking on you. So if you can use laxatives, you can drink. We have syrup that softens the stool so that when you go there, when you go to the toilet and you are pushing the poop out, it does not hurt you. It does not worsen the issues. Now, you can always do painkillers like paracetamol, just to mention about a few. However, I have this warning. If you know that the hemorrhoid is bleeding, kindly avoid what we call ibuprofen. Now, ibuprofen is locally known as brufen. Avoid brufen. Why? Because it will make the bleeding even worse. And why is it so? Brufen is grouped under a group of medicines called non-steroid anti-inflammatory drugs. So when you consume it when you are bleeding, then chances are the bleeding would even become worse. Other treatment is we have creams and ointments that you will be given to apply there. So when you apply them, the pain will subside and also the bleeding would stop. We also have suppository. Now, what is a suppository? A suppository is medicine that is administered through your rectum. In other words, it is a medicine that is in the shape of a candle, just a tiny candle, a small candle. So it is pushed through the anus into the rectum. Then it is it gets in through the rectum and it melts at around 36 to 37 degrees centigrade. So that will also help to relieve the pain. Some suppositories are like the Anusol and the Anomex. They also work well. If you don't get money probably to buy all these medications, you can always have your warm water in a basin, then add a little bit of salt, just a little bit, then sit on it so that it accesses the hemorrhoids. What am I giving as a parting shot here? Do not misuse antibiotics treating hemorrhoids. Why am I insisting on that? Because using antibiotics where it is not supposed to be used is a health hazard. It can be detrimental in future for you. The people who use antibiotics without prescriptions, or you just go to over the counter and just prescribe for yourself medication, that is antibiotics, a time is coming when those antibiotics will not work in your body, and that will be a topic for another day. That is the time that we had today. I would request that if you find the videos useful, you subscribe. Thanks for listening.